Hello, students. Thank you for listening to this important episode about vital signs. Are you ready to begin? Okay, let's go. Module 10, Vital Signs. Statement of Purpose. The purpose of this unit is to prepare students to know how, when, and why vital signs are taken and how to report and chart these procedures. Students will learn the correct procedure for measuring temperature, pulse, respirations, and blood pressure. They will learn to recognize and report normal and abnormal findings. Performance standards objectives define key terminology. Temperature. 1. Afebrile. 2. Axilla. 3. Celsius. 4. Fahrenheit. 5. Febrile. 6. Metabolism. 7. Mucosa. 8. Pyrexia. 9. Tympanic. Blood pressure. 10. Aneroid manometer. 11. Bell. 12. Diaphragm. 13. Diastolic. 14. Hypertension. 15. Hypotension. 16. Orthostatic hypotension. 17. Prehypertension. 18. Pulse pressure. 19. Sphygmomanometer. 20. Stethoscope. 21. Systolic. Pulse. 22. Apical. 23. Arrhythmia. 24. Bounding. 25. Brachial. 26. Bradycardia. 27. Carotid. 28. Pulse deficit. 29. Radial. 30. Rhythm. 31. Thready. 32. Tachycardia. Respiration. 33. Abdominal respirations. 34. Apnea. 35. Bradypnea. 36. Cheyne-Stokes. 37. Cyanosis. 38. Diaphragm. 39. Dyspnea. 40. Labored respiration. 41. Orthopnea. 42. Shallow respiration. 43. Stertorous. 44. Tachypnea. 45. Temperature, pulse, respiration, TPR. Pain, effects on vital signs. 46. Acute pain. 47. Chronic pain. 48. Phantom pain. 49. Pain scales. CNA Module 10 Vocabulary Practice Sentences. Temperature. The patient was afebrile, which means he had no fever or elevated temperature. The nurse assistant measured the temperature in the patient's axilla, armpit, using a digital thermometer. In most hospitals, temperatures are recorded in Celsius, where normal body temperature is 37 degrees. Some facilities still use Fahrenheit to measure temperature, where normal body temperature is 98.6 degrees. The febrile patient had an elevated body temperature and needed close monitoring. Good nutrition helps maintain healthy metabolism, which is how the body uses nutrients for all body activities. The doctor examined the mucosa, mucous membrane, inside the patient's mouth for signs of dehydration. Pyrexia is the medical term for when the body temperature becomes abnormally high. The tympanic thermometer measures core body temperature by placing the probe in the ear canal. Blood pressure. The aneroid manometer has a calibrated dial that shows blood pressure readings. The nurse used the bell part of the stethoscope to listen for faint heart sounds. Place the diaphragm of the stethoscope over the brachial artery to hear blood pressure sounds clearly. The diastolic pressure measures the pressure in arteries when the heart muscle is relaxed. Hypertension means the patient has sustained high blood pressure, usually above 140/90 mmHg. Hypotension occurs when blood pressure drops below normal, usually below 80/50 mmHg. Orthostatic hypotension happens when blood pressure suddenly falls as a person stands up. A reading of 130/85 indicates prehypertension, meaning the patient is at risk for developing high blood pressure. Pulse pressure is the difference between the systolic and diastolic blood pressure numbers. The sphygmomanometer is the instrument used to measure blood pressure. Use a stethoscope to listen to sounds in the body, such as heartbeat and breathing. Systolic pressure measures the pressure in blood vessels when the heart contracts. Pulse. To take an apical pulse, place the stethoscope over the apex of the heart. Arrhythmia means the patient has an irregular heartbeat that should be reported immediately. A bounding pulse feels strong and hard under your fingertips. Find the brachial pulse on the inner aspect of the arm at the bend of the elbow. Bradycardia is a slow heartbeat with a pulse rate below 60 beats per minute. Check the carotid pulse by feeling gently at the side of the person's neck. Pulse deficit is the difference between heartbeats counted at the heart and at the wrist. The radial pulse is felt at the person's wrist on the thumb side over the radial artery. A normal pulse has a regular rhythm with beats occurring at consistent intervals. A thready pulse feels weak and is difficult to feel or count. Tachycardia is a fast heartbeat with a pulse rate above 100 beats per minute in adults. Respiration. Abdominal respirations use abdominal muscles when breathing and may indicate respiratory distress. Apnea is the temporary absence of breathing that must be reported immediately. Bradypnea means slow breathing with fewer than 10 respirations per minute. Cheyne-Stokes respirations show an abnormal pattern of shallow breathing followed by deeper breathing, then stopping. Cyanosis appears as bluish discoloration of skin, lips, and nails due to lack of oxygen. The diaphragm is the muscle that separates the lungs from the abdominal cavity. Dyspnea means the patient has difficult, labored breathing. Labored respiration shows that the patient is having difficulty breathing normally. Orthopnea means the patient can only breathe when sitting or standing upright. Shallow respiration shows decreased depth of breathing that may not provide enough oxygen. Stertorous respirations are characterized by deep snoring sounds during breathing. Tachypnea means rapid breathing, usually more than 24 respirations per minute. TPR stands for temperature, pulse, and respiration, the basic vital signs measured together. Pain. Acute pain is severe pain that comes on suddenly and needs immediate attention. Chronic pain lasts for a long time and affects the patient's daily activities. Phantom pain occurs where a limb or body part has been removed but the patient still feels pain there. Pain scales help patients rate their pain level from 0, no pain, to 10, worst possible pain.